Well, what's interesting is one of the dynamics is that there's not been a net increase in the number of beds. The obsolescence is roughly equivalent to the number of new beds being built. So when you have the demographic wave and every year the demand goes up, there are more people getting dementia, more over 85-year-olds who typically make up the vast proportion of people in elderly care, and yet there's no net increase in beds across the country is counterintuitive. The reason for that is most, if not all of the new beds are in affluent parts of the country where the economics for someone like us only really work if you can do the business plan on a private pay model. I think what needs to happen to come onto the social care funding, it would resolve a number of things if you had a better funded, more secure, state-funded social care system, because you could pay people better, which I think is a scandal what the carers who do an amazing job don't, and that value is not recognised correctly because there just isn't the margin at a state-funded level. The second point is, if there were the sufficient margins, people like us would willingly build new product for that market or for a blended market. Whereas at the moment, it's actually quite old stock that caters for the local authority market. And so it would resolve a number of issues. So you'd actually then start to get the increase in supply of the beds. Because the investment market, as I say, there's a lot of appetite. Most of it's going into the sort of private pay, shiny, new assets. So I think the challenges for the opcos are staffing is one of the key things, and therefore actually a boost to what you can actually pay to people would make a big difference. I'm not sure changes in immigration policy, etc., is going to affect. I think that's worked its way through to a degree. The sector is relatively comfortable; they can deal with a different regime, but still sourcing and attracting and training staff is a big cost. So there's challenges, but actually I think operationally it's much healthier we see than say 5 years ago.